Do you know that men have vaginas? They actually have two vaginas. Calm down. It's not the same as the female vagina, but nevertheless, if you want to know where you can find vaginas in men, still to the end of this video and I'm going to show you. So yesterday, I posted this video asking for everybody's opinion, and some of my followers say it is epidermitis, some say it's epidermochitis, some say it's hydrocele, and some persons say it is pregnancy and they can even see the baby moving, but it's simply just testicular torsion. So on this video, I'm going to be doing a review of that video that I posted, and I'm going to be telling you some of the things that I saw sonographically that made me to come to that conclusion. So, firstly, what is testicular torsion? It is simply restriction of blood flow to the testis by twisting or tying of the somatic cord. So, what can actually cause this? It's majorly caused by what we call bell clapper deformity, whereby some strings that are supposed to like hold the epidermis to and the testis to the posterior wall of the scrotum fails to form. So when the person is exposed to trauma, excruciating kind of like exercise or intense kind of sexual activity, like they duck a lot, you understand, they'll actually be prone to having testicular torsion, and it can be very very acute, in which that if it's not treated between 4 to 6 hours, there's high tendency of that person losing that testis. So let's dive into the video, and I'm going to show you what I saw sonographically that made me to come to that conclusion. So before we go into the video, when we're doing ultrasound, there are like 5 things we watch out for in testicular torsion. One is thickened epidermis and also enlargement of the testis. Two, we have a reactive hydrocele due to the torsion. Three, we want to see the Wilpole sign, which is showing us that, yeah, this is where the torsion occurred. Then we have thickened scrotal wall and little to no intratesticular blood flow at all. So let's dive into the video and I'm going to show you. So I'm going to be very fast in the video. I'm going to be showing you guys the testicle. So this white thing here like this is the testicle. This is the testicle, and it's actually meant to appear very plain. But if you look at it now, there are some like dark spot on it, so which is showing us that it is heterogeneous. So next, we're going to be looking out for where the Wilpole sign is. So around this region here, we can see the Wilpole sign, and we can see it's moving this way. It's moving this way like this. So that's the Wilpole sign. Is very, very highly suggestive of torsion. And if you turn on the Doppler, which I did not do on this video, you're supposed to see the blood moving round in cycles like this. Then we're also going to look for the reactive hydrocele. So this region like this, that is all black. Around here also, that is all black. This whole region are filled with water. So that is the reactive hydrocele in that region. Then we're going to be looking for the epidermis and the scrotal wall. So here, this is the epidermis here, and it's very thickened. And then lastly, we'll be looking for the scrotal wall to see how it is. So this is the scrotal wall here. This is the scrotal wall here, like this. So we can see that it's also very thickened also. So basically, those are the things we see on ultrasound, and we'll be able to like, yes, this is definite of testicular torsion. In this video, I did not carry out the Doppler scan of the testicles, in order I would have shown you guys how there is little to no flow within the testis. So down to the part a lot of you guys have been waiting for, where can we find the vagina? So in that video, that region I showed you that the whole region are appearing black with the whole reactive hydrocele, that is actually the vagina. In medical anatomy, we call it the tunica vaginalis, but a lot of medical practitioners like to call it the vagina of the testis. So it's actually a fascia that outlines the outer part of the scrotum. Is like a sac. So if there's any infection around that region, there's fluid buildup or there's water build up within that region. So it's found in the right and the left testes. So that's the reason why I said men have two vaginas. So basically, you have it, guys. So if for any reason there is a torsion outside the vagina, we call it extra vaginal torsion. And if there's any torsion within the vagina, we call it intravaginal torsion. So the intravaginal torsion is common in adults, while the extravaginal torsion is common in neonates. That's children that are still in the womb. That's the one that is very common in them. So if you like this video and you like the review I did on this video and you want to see more of this video, do very well to drop a comment on what you want me to talk about, and also follow me on my Instagram, TikTok, Facebook, and also my YouTube page at The Celebrity Radiographer for more of this content. See you guys.